friends, don't ignore spots on your skin. Even if your doctor said they're nothing, they can be an early sign that your metabolism is off. It's not just aging or bad genes. More often, it's something in your daily routine. Over-the-counter meds, processed foods, and even certain supplements can mess with your system and show up on your skin. Most people, they miss a connection. But spotting it early is easy, and fixing it might start with just looking in your medicine cabinet. Do you ever take over-the-counter pain medicines for that occasional headache or cramp? Then I bet you have some NSAIDs in your cabinet or your purse. They classically cause brown phototoxic skin spots, especially naproxen. NSAIDs are non-steroidal anti-inflammatory drugs, and they actually can cause a variety of skin conditions from itchy brown spots to severe giant red patches to giant blisters that can involve the inside of your mouth and your gut. Now, these life-threatening skin reactions have received very little attention. So why does naproxen cause brown spots? It's actually a reaction that occurs with UV light or sunlight. Piroxicam is also linked to photosensitive eruptions and hyperpigmentations. Ketoprofen is also strongly phototoxic and can lead to eczema and brown staining. Now remember folks, this isn't medical advice, so don't start or stop any of your medications until you speak with your own personal medical doctors. So what does phototoxic mean? A drug is phototoxic when it chemically reacts with ultraviolet light. Ultraviolet light by itself can cause cell damage, but when that reaction occurs, more cell damage can happen. That damage causes inflammation in the skin, which is followed by hyperpigmentation or brown spots. Anyone ever tell you to avoid the sun while you were taking NSAIDs? Unlike sunscreen, NSAIDs become reactive when it absorbs UV light, causing chemical changes in oxygen, which forms reactive oxygen species like singlet oxygen or superdioxide that directly binds to your proteins, your lipids, and your DNA. You have all of these in your skin. Now that's a lot of chemical jargon that can be summed up in one word: sunburn or inflammation. When you get sunburn, you get inflammation. Then you see the redness in your skin and ultimately you start peeling. You have sloughing of dead cells due to the original sunburn. Now luckily, your immune system protects you from sunburn by activating melanocytes that increase melanin production, which results in brown pigmentation. Have you noticed that after you sunburn, you're a little bit darker, you're browner in color, right? That kind of persists. Some people call this tanning, unless it's caused by NSAIDs. Because NSAIDs, well, you can imagine if the chemical is not evenly dispersed throughout your skin that it would be blotchy. Hence you get blotchy brown spots. Now, if you've never had this happen before, that's great for you, but just know that anyone can get this reaction with enough drug and light exposure. This is a dose-dependent origin and not an immune phenomenon. But NSAIDs can stimulate the immune system to cause allergic issues, such as urticaria pigmentosum, and life-threatening allergy issues called angioedema, in which you get swelling of the face and lips, as well as potentially your throat. Now, when your immune system is stimulated like this, you have fluid shifts and tissue swell. So this means you are hypersensitive to NSAIDs. And like I said, this could be very life-threatening and can lead to systemic complications, including cardiovascular complications, elevated blood pressure, or even fluid retention, especially in the wrong places. If this happens, this is a trip to the emergency room. This needs to be addressed ASAP. Your skin really serves as an early sign of drug-induced stress to the rest of your body. And everyone is different. Some people develop non-specific skin changes like dryness, flushing, itching, or discoloration. These are very subtle. Sometimes your skin problems reflect liver inflammation. Your NSAIDs are processed in your liver. Sometimes it's kidney dysfunction. Your NSAIDs actually are toxic to the kidneys and prevents the renal system from perfusing properly. Systemic inflammation or immune dysregulation occurs with NSAIDs, and this can increase cardiovascular risks, especially in people with pre-existing high blood pressure or heart disease. Did I mention that NSAIDs commonly cause anemia, ulcers, and bleeding in the gut? So you have heart attacks, kidney failures, strokes, high blood pressure. These are all elevated when you use NSAIDs for a long time. I don't see how NSAIDs are considered safe enough to be sold over the counter when we have hundreds of thousands of people every year who have complications, some of which are very life-threatening from using NSAIDs. Now, in order for you to understand early skin warning signs, you should have a basic background of your skin. Your skin is your largest immune organ and makes up 15% of your body weight. Ever scrape your knee and bleed, but sometimes you don't bleed? Why is that? Well, superficial scrapes or abrasions, they only involve the epidermis, the layer of your skin that's on top and that doesn't have blood vessels. So when you're feeling your skin, you're feeling the epidermis. Now, if you bleed, you've hit the dermis. If your skin grows back lighter, you've actually removed melanocytes, and those were the cells responsible for your pigment. So you have first the epidermis, below that you have the dermis, and then you have subcutaneous tissue. Now, the exact percentage can vary depending on your age, body composition, and hydration. But in general, your dermis is the thickest skin layer made of connective tissue, including collagen and elastin. And collagen makes 70% of your dermis's weight, structure, and strength. So if you find yourself bruising and bleeding more easily, your collagen is likely weaker and thinner. People often tell me it's because they're on blood thinners. And certain blood thinners, ironically, can actually cause tiny blood clots to the tiny vessels in the skin, like Coumadin or warfarin. It's so bad that it can cause skin to be necrotic, especially skin around high fat areas like breast tissue, your buttocks, and your thigh. And when this happens, it's going to happen within a week of starting therapy. So if you notice any weird things going on with your skin, remember, talk to your own medical doctor. Don't just stop your medications. So another well-known skin affecting medication are steroids. And instead of darkening the skin, it actually makes the skin lighter. You get light spots. And even worse, sometimes you can get dark patches and thinning of the skin, stretch marks, and acne. So steroids usually refer to two main classes: corticosteroids, so drugs that are synthetically made to mimic cortisol, the stress hormone. But cortisol actually reduces stress. It's anti-inflammatory. So we commonly make these drugs, corticosteroids, to help people with asthma, arthritis, autoimmune diseases. Then there are what those bodybuilders use, anabolic steroids, which is a synthetic version of testosterone. People use it to build muscle or enhance performance. However, they both have side effects. Steroids are commonly found in pill form, such as prednisone or dexamethasone. You may have heard of it as cortisol, and anabolic steroids are known as Dianabol. They are both easy to take in pill form, and unfortunately, they both cause inflammation in the liver, especially anabolic steroids, and can cause acne and oily skin. Corticosteroids can cause skin thinning and bruising more easily because it inhibits collagen synthesis, so it makes your skin thinner and more fragile. You'll see more fine lines, wrinkling, and visible blue blood vessels. And when you injure yourself, you will have delayed wound healing as well as dryness. Usually on the outside, there's an oil layer on your skin, but corticosteroids inhibits the lipids from forming this oil layer. And this leads to your skin to become dehydrated, dry, flaky, and irritated. You also become more susceptible to different types of germs, since broken skin is a portal of entry. And remember, it's not just skin that you see on the outside of, like, behind your hand, but it's also the skin that coats your mouth and your internal organs. When they are exposed to the outside world and when there's breaks in them, you are more susceptible to infections like in your lungs and in your gut. And these effects are more severe when you inject steroids. But they can also happen when you put topical steroids. Let's say to treat eczema or psoriasis or some itchy rash. You can locally thin your skin. It could be so bad that you can have stretch marks. Some people use steroids for acne or rosacea, and prolonged use can then show visible blood vessels, right? You're going to be blue all over. And if you suffer from seasonal allergies, you may be spraying steroids in your nose, nasal steroid inhalers, right? They can also cause skin changes, especially inside your nasal passage. And that's why they tell you to aim it outside, away from the septum, because it actually can put a hole through the septum. Your septum is made out of cartilage. There's no blood flow there. So long-term use can cause tissue damage. And in certain people, even spraying nasal sprays can suppress your adrenal glands. And many of these drugs you can buy without a doctor's prescription because they're over the counter. So if you're suffering from skin conditions or seasonal allergies, allergies that require long-term steroid use, I hope you're looking into your diet. And oftentimes food triggers these conditions or can exacerbate them. It's critical that you keep a food diary so that you can figure out if something you are eating is worsening your symptoms so that you could just stop eating them. Now, if you've ever been on oral steroids, you know that it can cause elevated blood sugars. Excessive blood sugar elevation causes a process called glycation, not to be confused with glycosylation, which is a normal cellular process. Glycation is what happens when excess sugar in your bloodstream randomly sticks to proteins, fats, and DNA. This forms sticky molecules called advanced glycation end products, or AGEs. And yes, the acronym fits. These AGEs can accumulate in the skin proteins like collagen and elastin, causing them to be stiff, damaged, and it's contributing not only to wrinkles, but also to brown patches. This happens in people who have uncontrolled or poorly controlled diabetes, where blood sugar is chronically high. AGE formation goes into overdrive when this occurs. And that's why people with poorly controlled diabetes, they often develop more skin pigmentation and vascular issues, which gives them unique skin spots. If you have prediabetes or diabetes, check your neck, your armpits, your groin, and your knuckles. Do you see dark, velvety, thickened patches? Sometimes they're brown or grayish. If you have those, then you have high insulin or insulin resistance. Insulin is a growth hormone, and high levels of insulin triggers skin cells to overgrow and pigment production. This is a warning sign that you have prediabetes, type 2 diabetes, or metabolic syndrome. So these pigments are called acanthosis nigrans. Now take a look at your shins, your thighs, and your arms. Do you see light brown or red, round or oval, scaly patches? Sometimes they're flat, sometimes they're slightly indented. Now they may be harmless by itself, but they are a marker of uncontrolled diabetes or poor glucose control, which damages blood vessels, these small blood vessels. So we call it microangiopathy. It causes poor circulation and reduced healing. Those are called shin spots or diabetic dermopathy. Now, if you have yellowish brown or reddish patches with raised shiny borders and possibly even an ulcerated center, necrobiosis lipoidica, resulting from inflammation and damage to collagen causing blood vessel changes. These conditions can happen in type 1 and type 2 diabetes. Type 1 is caused by failure of the pancreas to make insulin, and we treat it by giving people insulin. Type 2 diabetes, that's caused by food. And here's where it gets controversial. The real cure for diabetes is really not a pill or injection, despite what you hear on social media. If you take Ozempic or another GLP-1 agonist, you will have to take that treatment for life. If you're on an oral diabetes medicine, it's not uncommon that you will need more than one. If you have to take a treatment for life, does not meet the definition for cure, right? However, there are well-documented cures for diabetes. But the problem is you have to remove the offending foods, and you have to remove the right ones. Otherwise, you not only don't get diabetes control right, you don't get your health back. Now, no matter what you pick though, the first rule of beating diabetes is to lose weight. If you can lose 10 to 15% of your current body weight, you can get partial or full remission of type 2 diabetes. Now, this is especially effective within the first few years of diagnosis, and more effective when your weight loss is from your liver and pancreas. So that means getting liposuction will not reverse your diabetes. They cannot liposuction the inside of your gut. And what's causing you your diabetes is the fat that's in your liver, in your muscles, and in your abdominal cavity. Now, if you can lose more than 15% of your body weight, you have an even better chance to stay in remission. Now, the only way to lose body weight, no matter your diet, is to simply eat less calories. And it's easy for me to say, but it's really hard to do in real life, because oftentimes eating less calories lead people hungry, and that's why calorie counting simply doesn't work. So if it comes down to eating foods that will lower your calories or not feeling hungry, oftentimes people will choose the not feeling hungry part. And this is where diet camps come in. In reality, you can choose from any of these camps and reverse your diabetes. But unless you pick the right camp, you may not continue. And there's so much more than just diabetes that we have to address for our health. These fad diets like the carnivore diet, ketogenic diet, vegan diet, paleo diet, Even a vegetarian, whole food, plant-based diet, they will all work to reverse your diabetes as long as you stick to them and you eat less calories. Now, what if I told you that many of these diets, sure, they will cure you of your diabetes if you stick to the diet, but they elevate your risk of cancer, atherosclerosis, and they shorten your longevity. Is it worth it to cure you of diabetes, help you lose weight, but leave you at higher risk for other serious problems? Personally, I would say no. And if you're in my camp, then you need to pay attention to your food quality. It makes a huge difference.
Hi, friends. I am so thrilled that you want to take charge of your health and take charge of your food. Now, I know nutrition can be complex, but it doesn't have to be. And I'm here to support you in this lifelong journey. So if you point your camera app to this QR code, it'll take you to a link for a free handout that I created just for you. And if you like it, if you want to see other handouts, please go to the link in my show notes, and then you can leave me your feedback on what I could do to help you in your journey. Okay, back to the video now.
So all these diets, they really address the quality of your food, and they disagree on what kind of quality is best. If you value fat as a good quality food, then you'll be in the ketogenic diet camp. 75% of calories need to be pure fat if you do a ketogenic diet. Now, if you value animal meats as a good quality diet, then you're likely a carnivore diet, or maybe even the standard American diet. If you think carbohydrates are poor quality foods, then you're going to be on a low carb diet or a carnivore diet or a ketogenic diet. Or maybe you're just avoiding grains. That means you're on a paleo diet. Now, if you just take a step back, can you think of long living societies who eat these fad diets in nature? Now, I can think of traditional Inuits. They ate high fat seafood diet, but they also had a genetic mutation that made them more adaptive to their harsh, cold environment and their diet. I don't think I have Inuit blood, so I can't eat like them. But I also don't want to eat like them. The average life expectancy of Inuits were 35 to 45 before the 20th century, and now they're almost doubled their lifespan. Some live to their 60s or 70s. This is not better than America. We rank in the 40s in terms of longevity. So I don't think I want to follow the Inuit diet, which seems to be worse. And to be fair, the modern Inuits, they're eating more of a Western processed food diet. Hence, any diet that eliminates processed food is just a good place to start. And by just eliminating processed foods, you're gonna eat less calories. This sounds simple in concept, but it's difficult to do because 70% of our grocery stores are filled with processed foods, and everybody's addicted. But obviously, not all processed foods are bad. The ultra processed foods, where things have been turned into powder, and then we had water to reconstitute it, and you shape it into some cute shape, right? Like a muffin or a cake. Those are all baked goods. Those are not good for our health, and that is why paleo, carnivore, and low-carb people, they all try to avoid grains because we've turned grains into an ultra-processed food. Grains are responsible for 90% of the junk food on our market. So let's talk about processed foods that can help you improve blood sugars and insulin resistance. My favorite is tofu. It is a low carbohydrate, high protein and calcium food that has protective phytonutrients. So I make sure I eat tofu multiple times a week. Tofu is a minimally processed soybean product. I like it because it's convenient, it's soft, it adds texture to whatever I want to elevate. Now, they have many different kinds of tofu textures, soft, medium, firm blocks. You can actually stir fry, scramble, or steam them, or eat them directly out of the box. And beans in general should be a part of everybody's diet. They have a low glycemic index, and they help lower blood sugars during the meal, and they have a second meal effect where they continue to lower blood sugars in the meal after you eat the beans. Now, if you're looking for a firmer texture, then try tempeh, which is fermented soy, or sometimes it has other grains. That's another high protein source that can add a variety of phytonutrients. I personally stock up on canned whole beans. I buy the low salt brands. Usually I try to find organic, and I always have some canned beans ready in my pantry to make quick, delicious dishes. One dish I thoroughly enjoy that's so easy is hummus. Hummus is made from garbanzo beans. You just basically rinse that can of garbanzo beans, put it in a blender with a clove of roasted garlic, a tablespoon of lemon juice, a tablespoon of onion powder, and then a little bit of olive oil, maybe a teaspoon, and then a quarter cup of ice cubes. You blend that. Now, if it's too thick, you can add more ice cubes and it blends nice and creamy. Now, you can upgrade the flavor by adding vegetables and even peppers like chipotle. So I made a chipotle and cilantro hummus. You really could use whatever vegetable you want to eat. If you need some salt, I would recommend potassium salt if you don't have any kidney issues, or miso. I use my hummus as a salad dressing, dip, spread, or you could just simply eat it right off the spoon. And if you don't have a blender, you can always buy hummus. Now, I always rinse my canned beans before I use it because I really don't like the BPA lining in beans. So I try to find BPA free, but they're going to have some kind of lining, right? So there are many quick, minimally processed foods that you can pull from in the supermarket. Take frozen blueberries. I have a bunch in my freezer all the time. Fresh blueberries just simply don't last very long, so I go through lots of blueberries every week, and if I didn't have it frozen, I would have to go shopping quite often. And frozen blueberries are picked at the ripest point, and then they're flash frozen. This retains as much nutrition as possible. It's not just blueberries, you can go for frozen vegetables. I have a variety of frozen vegetables handy in my freezer, including spinach, kale, carrots, and peas. If I prepare it, I will rinse and wash it and then freeze it. So when I take it out, I don't have to rinse it. But if I were to eat them raw, especially store-bought, I would rinse them again. And another vegetable that comes in a can that some people actually consider a fruit like me are canned tomatoes. Tomatoes have a wonderful amount of lycopene. If you can find your tomatoes in a glass storage container, that would be best. Like I said, many cans have BPA. You need some kind of lining, even if it says BPA free, so that you don't absorb the metal of that can. Something will generally leach in the food. That's why I always try to rinse the food, but canned tomatoes are difficult to rinse. But sometimes you may have dry processed foods. Maybe you have some oatmeal. A lot of influencers think oatmeal is the worst food you can eat, and others believe oatmeal is a healthy food. In terms of diabetes, it's so confusing because oatmeal isn't usually eaten by itself. People usually add honey or some kind of sugar to oatmeal to make it taste better, which then spikes blood sugars higher. And then they blame it on the oatmeal when it was originally the honey. But in reality, oats have been shown to cure diabetes in the early 1900s. Dr. Elliot Jocelyn, a graduate from Yale, had an aunt and his own mother diagnosed with diabetes. So he ran the largest diabetic clinic in the world at that time and compiled 1,000 of his own cases. And he wrote the first diabetes textbook called The Treatment of Diabetes, in which he said he reduced his patients' mortality by 20%. Now, he took a 3-pillar approach to diabetes. Number 1, he advocated for really strict glucose control. Number 2, he advocated for testing. If you don't test, you don't know. Number 3, he advocated for daily exercise. And when insulin came about, he also used insulin to achieve victory for his patients with type 1 diabetes. However, the world was reluctant to take his recommendations. Now, he himself lived to 92. He passed away in 1962. It was 31 years before his approach was validated by a 10-year study called the Diabetes Control and Complications Trial Report, which was published in the most prestigious medical journal called the New England Journal of Medicine. And this study demonstrated that tight glucose control can help delay diabetes complications. Now, Dr. Jocelyn, he restricted animal protein, but he allowed people to eat eggs. However, he got the best results when people didn't eat eggs. Now, keep in mind, this was 100 years ago when doctors didn't understand diabetes. Dr. Jocelyn noted that his diabetic patients were overweight and obese. And even the young patients, they were at higher risk of diabetes if they were overweight and obese. And people who spilled sugar in their urine, they were rejected by life insurance then too. He also noticed that these people didn't have muscles and that people overweight and obese didn't have muscle reserves. Even at that time, people knew your muscles are your largest organ to help you mitigate carbohydrates. It stores your carbohydrates. So if you want to improve your blood sugars, you have to grow more muscles. And the only way to grow more muscles is to exercise. And he literally wrote in his book, what is added to the waistline is cut from the lifeline. Amongst his patients with diabetes, 41% of them were obese. And he took copious data of his patients, including their weight and height, and followed them, and to see if he can find trends. Back then, Dr. Jocelyn knew that type 2 diabetes was from dietary excess. And today, social media influencers, they want to blame carbohydrates. But Dr. Jocelyn, he even said that it's not carbohydrates, it's the excess food rather than carbohydrate, which does the harm. And he went on to explain that the Japanese people, they lived on a diet with basically rice and barley, and diabetes was really rare back then. And then he also compared Germany to the United States. The Germans ate half as much sugar as people in the United States, but diabetes was just as prevalent in Germany. And he acknowledged that sugar consumption was increasing quite rapidly. On the surface, it appeared that the two would be related. But knowing the Japanese diet, he realized that eating rice and barley, it's essentially sugar, and they had very low rates of diabetes. So this proved that sugar is not the cause of diabetes. However, what he didn't realize was that the sugar in table sugar is very different than the sugar in rice and barley. Rice and barley has glucose, which is what the body needs for energy, as well as for structure. Table sugar has glucose, but it also has fructose, and fructose is a metabolic toxin to the liver. Fructose makes your liver fat. Literally will turn it into foie gras. You will get fatty liver if you eat enough fructose. And this becomes the beginning of insulin resistance or the road to diabetes. If you have other drivers along with this fructose. Now, Dr. Johnson also noted that his patients consumed alcohol, considerable amounts of alcohol. And now we know that alcohol is also a toxin to the liver and was the original cause of fatty liver. The metabolism of fructose is similar to the metabolism of alcohol, and hence together they can both cause fatty liver. Many physicians, even modern physicians, have forgotten that traditionally around the world, people ate a ton of carbohydrates. In fact, they were exclusively carbohydrates. Remember the Italians and their corn polenta, or the Asians and their white rice? They got really serious life-threatening diseases like pellagra and beriberi, but they didn't get diabetes. So when you do these kind of unhealthy dietary restrictions, it's not just diabetes you have to worry about. And during that time, it was shown that oatmeal can help to reverse type 2 diabetes. Published reports show that people who go on an oatmeal diet can reverse their insulin resistance within 48 hours. Now, one patient required more than 200 units of insulin on the day that patient was admitted to the ICU, and they were giving her standard diabetic tube feeds. So instead, the doctors decided to make their own tube feeds out of oatmeal and vegetables. It's weird that today we restrict people to just manufacture liquid foods to go down the tube feeds. But people around the world, they want to eat real food. And just because you have a tube feed, I don't see why you can't just blend the food and put it through the blender. Just don't clog your feeding tube. So you should check with your gastroenterologist what will clog it and what won't. And when they gave the patient oatmeal and vegetables, she went from a blood sugar of 250 to 100. And 5 days later, she required 160 fewer units of insulin. Several studies have suggested that just by incorporating some oatmeal, the effects of lowering blood sugar can potentially last for a month. And you can measure your success by how much insulin you need. People can drop their insulin by 40% in just 2 days compared to just reducing calories to treat diabetes. The driver of this obesity diabetes loop is insulin. The higher your insulin, the higher your weight becomes. So the goal for everybody, whether you have type 1 or type 2 diabetes, is to use the lowest amount of insulin that is required to normalize your blood sugars. You won't know that unless you check your blood sugars. But don't just go on a radical oatmeal diet on your own or any kind of diet, especially if you're taking insulin or any diabetes medications or any medications really. You should talk to your medical doctors. On a day-to-day basis, your blood sugar fluctuates. It can actually fluctuate quite significantly within a 24-hour period. So if you go radical on your diet, your blood sugars may bottom out. And when that happens, you may not wake up. That can be seriously dangerous. You can pass out or not wake up. We don't want that to happen. And it's not just Dr. Jocelyn. Other physicians have treated obesity and diabetes by giving people carbohydrate. Have you ever heard of the rice diet? High carbohydrate diet invented by Dr. Walter Kempner from Duke University in the 1930s. He was actually able to reverse malignant hypertension, which FDR suffered from before we had medications. He improved kidney disease, heart disease, as well as obesity. And you know what he fed people? Rice, fruit juices, including sugar. He had vegetables. They controlled the amount of protein and whole grains. The key to his diet was that it was low in fat, low in protein, low in sodium. Some people lost 100 pounds on his diet, which dropped their blood pressure and cholesterol significantly. However, he didn't supplement his patients properly with micronutrients, so some of his clients actually didn't make it. Hence, you have to be very careful with any restrictive diet that you go on. Because when you restrict food, you restrict micronutrients. And these micronutrients, they may not give you calories, but they are essential for life. The point is, you don't want to lower your waistline and lower your life expectancy at the same time, right? There are over 30 essential micronutrients that people need, many of which you need on a daily basis. And when you miss just one, well, you can get pretty sick. But luckily for us, we have supplements available. There is no perfect diet. Just one micronutrient and your diet can make you really, really sick. Take vitamin D. We now know many people have an inadequate amount of vitamin D, and we have supplements for that. Let's say you're on a vegan diet. You're going to be missing vitamin B12 simply because B12 is not found in any plant food. We also have supplements for B12. And if you don't supplement with B12, you run the risk of getting a stroke. But what if you're on an ultra-processed food, standard American diet or vegan diet? You'll be missing much more than just one vitamin. Processed foods are very low in vitamins. It's low in minerals, low in phytonutrients, many of which are low in proteins, as well as essential fatty acids. So don't confuse being full and hitting your calorie bucket and gaining weight with being healthy and hitting your essential nutrients in an adequate amount. You may be overfed and undernourished. If you're on a carnivore diet and think that meat is king, well, you'll be missing a lot of nutrients that meat doesn't have. Take, for example, vitamin C, vitamin K1, vitamin B9, vitamin E, vitamin A, and vitamin B1. You'll also be missing a ton of fiber. And with that fiber comes plenty of phytonutrients that we haven't bottled yet. So if all you do is eat meat and some form of grain, which many people do as your standard American diet, you too will be missing many vitamins and minerals and phytonutrients as well. How about magnesium, potassium, manganese, and iodine? Those things you don't find in every food group. If you're on a ketogenic diet and predominantly eating 75% fat, you'll be missing a lot of water-soluble vitamins and minerals like magnesium and potassium and fiber. You're going to have to eat quite a bit of leafy greens and fruit. The point is, there's no diet that's going to be complete. And when you choose the wrong diet, you actually elevate your risk of getting diabetes, as well as reducing your longevity. And when you lose weight, you're restricting your body's access to micronutrients simply because you're eating less food. And this is actually the time when your body needs those micronutrients so they can efficiently use those calories and convert it to energy more efficiently, especially because you're eating less calories. And when you're not doing your diet right, the first sign is your skin. Take a look at your hands. Your hands will start to get dry, chapped, maybe some hangnails. You're always using your hands, right? You're washing them, exposing them to soaps and detergents, or you have a very physical job. That skin needs to be strong enough to withstand the stress of your activity. Your wounds need to heal overnight, not in several weeks. And I know when my diet takes a hit because my hands, they get chapped and dry. And it happens to me too because I get busy and I skip meals. Now, granted, I'm a healthcare worker, so I have to wash my hands and sanitize my hands before and after I interact with every patient. And I struggled with skin problems until I started supplementing. That's because many times I don't have time to eat all day. I used to just assume my hands were suffering because I was allergic to the soap in the hospital or in my clinic, or I was using too much alcohol, right? But now I use just as much soap, if not more, and yet I have better skin. I tolerate the stress better because I'm fulfilling my micronutrient buckets with my diet, and then I supplement to fill in the nutritional gaps. Really, who likes dry, cracked hands, right? They're painful. And when you have the right nutrients, not only will your skin look better, but your hair and your nails will be healthier. You're probably wondering what kind of supplements I'm talking about. Well, if you're interested in that, watch the next video.